Here with me to break it all down is USA Today's Washington Bureau Chief, Susan Page. Susan, thanks for joining us.
Hey, DeMarco, it's great to be with you.
All right, the nonpartisan Congressional Budget Office didn't get a chance to score the House GOP's health care bill. That assessment could come as soon as this week. How could that impact the Senate debate?
It's going to have be a big part of the Senate debate, because you remember the last time the CBO scored the Republican bill, it said that 24 million Americans would lose health insurance coverage under the plan. That number may change some now because the plan has been changed somewhat. But that's a big number and will be a big part of the debate going forward about all those millions of Americans possibly losing the health care coverage they've come to expect under the Affordable Care Act.
All right, the 13 senators working on their version of the bill amend. Is that likely to cause any skepticism?
You know, you may have seen the pictures on Twitter of those 13 men who are going to be making the decisions in the Senate and drawing together this new health care plan. They say, some of them say they're starting from scratch, and not a single female face up there. I think that was something some Republicans thought was unfortunate, and I would predict that we see Susan Collins or some other female face up there as this goes forward, because of course the health care proposals will have big effects not only on men but on women in this country.
So what needs to change in this bill for it to pass the Senate? That's the big question.
It is a big question. And what can you change in the bill that doesn't undermine its prospects of getting approved by the House when it goes back there, when you go to a conference committee, if it gets that far? You know, one of the things that we hear senators very concerned about is the expansion of Medicaid. 31 Republican states have expanded Medicaid. That's very important to some of the senators who will be important in this debate. Also, funding of Planned Parenthood is another issue on which the House and Senate are likely to come to different conclusions. So those are two of the big issues I think you're going to see going forward that could be a point of division between House Republicans and Senate Republicans.
It's also interesting to point out that the Republicans can pass this with a simple majority, no Democrats required. Why is that?
Well, they could, because they're doing it under a provision, a parliamentary maneuver called budget reconciliation. It can't be filibustered, so you just need 51 votes. That means you need 50 Republican senators to go along with it, and then you could have the Vice President, Mr. Pence, break that tie. That means you can only lose 2 Republican senators, assuming you don't get any Democrats, and that's how we're assuming. You can only lose 2 Republican senators and still get through, even while using budget reconciliation.
There's been a lot of talk about how this bill could affect the 2018 midterms, and we're already starting to see that bubble up at town halls. Do you think this will be a major issue for both sides?
You know, if you look at our experience with debating health care, when the Affordable Care Act was being debated, it certainly proved to be something that had a big impact on the 2010 midterm elections, on the 2014 midterm elections. And you know what's notable about those two is that in 2010, that's when Democrats lost control of the House. 2014, when they lost control of the Senate. In that first midterm election after the Affordable Care Act was passed, Democrats lost 63 House seats. Well, Democrats need to gain only 24 House seats this time around in 2018 to regain control of the House, and that is now at least a possibility.
All right. Meanwhile, the investigation into Russia's meddling in our election is still moving forward. Former acting Attorney General Sally Yates is expected to testify tomorrow before Senate Judiciary Subcommittee, I should say. What can we expect from her?
Well, I think this will be very interesting to hear, in particular, more about Michael Flynn, the general who was President Trump's initial national security advisor. Sally Yates played a key role in raising questions about Flynn's ties to Russia and his contacts with Russia. And I know that there's going to be a lot of interest from the Intelligence Committee in pursuing what exactly happened there.
All right, Susan Page in Washington. Susan, thank you.
Thank you, DeMarco.